Exploring digital health and innovations. Welcome to Sarid Podcast. This is the lecture segment where we break down complex topics into simple, relatable discussions. Today we are looking at digital health and innovations, lecture 1. Let's explore the evolution of digital health, healthcare consumer empowerment, concepts and definitions of digital health. Dimensions and scope of digital health in healthcare delivery. How to operationalize digital health and its advantages and challenges. Segment 1. The evolution of digital health. Digital health marks a shift in healthcare aligned with the fourth industrial revolution. This era leverages big data, analytics, and artificial intelligence to enhance healthcare efficiency and accessibility. While sectors like finance and commerce adopt these innovations earlier, healthcare is now catching up with solutions that make care more integrated and patient focused. Segment 2. Healthcare consumer empowerment. Patients are now at the center of healthcare. Digital tools are driving this empowerment through 1. Learning and managing health proactively. 2. Connecting with communities for support and shared experiences. 3. Taking control of health decisions. 4. Managing personal health information. 5. Ensuring data accuracy. 6. Collaborating with providers for shared decision making. 7. Engaging through improved health literacy. Segment 3. Concepts and definitions of digital health. Digital health combines e-health. E-health is using ICT for health-related activities. M-health is mobile and wearable technologies for health objectives. Artificial intelligence is simulating human intelligence for healthcare processes. Together, these technologies form a digital health ecosystem, improving outcome and efficiency. Segment 4. Dimensions and scope of digital health. Digital health emphasizes 1. Personalized care, tailored to individual needs. 2. Predictive analytics, turning data into actionable insights. 3. Governance and accountability. 4. Interoperability, seamless data exchange across systems. Its scope includes telemedicine, electronic health records, digital pathology, and more. Segment 5. Operationalizing digital health. Key components for successful implementations are strong application architecture, infrastructure like hardware and software, ensuring systems are interoperable. Principles for development include user-centered design, scalability, and privacy protection. Segment 6. Advantages and challenges. Digital health offers efficiency, accessibility, and personalization. However, challenges like data privacy and the digital divide require attention. Closing segment. Digital health is revolutionizing healthcare, placing patients at the center and enabling transformative solutions. Thanks for joining this lecture segment of Sarid Podcast. Share your feedback and stay tuned for more. Until next time, keep learning and growing. Thank you.